My name is Michael Battelle, and I'm the president and founder of the Fatty Liver Alliance. We raise awareness about the risks, causes, and complications of fatty liver disease and help those already diagnosed with NAFLD and NASH by advocating for access to approved treatments and care. Today's discussion with our very special guest, Dr. Mohit Kehar, who is a pediatric hepatologist, is about a very important topic for all of us: screening patterns of non-alcoholic fatty liver disease in children with obesity. Mohit, you were senior author on this paper that was just published in the Canadian Journal of Gastroenterology and Hepatology, which is a cross-sectional study done in Canadian primary care. Mohit, why did you do this study and what did you find?
Thanks, Michael. Thanks for this opportunity to talk about a recent work that was just published on screening patterns of pediatric NAFLD in Canadian primary healthcare. So as you know, NAFLD is now the most common cause of chronic liver disease in children. And there is, in the past 2 decades or so, there is a rapid increase in the prevalence across the world. And because of this, the North American Society of Pediatric Gastroenterology and Hepatology have suggested screening using ALT in patients who are at high risk, specifically children who are obese and who have BMI over 95th percentile. And if their BMI is over 85th percentile, they should be screened if they have certain risk factors. So earlier in our work, we have shown there is limited awareness among our primary care health providers in Canada around NAFLD in children. And other adult colleagues have shown similar concerns regarding adult NAFLD as well. So we just wanted to explore this on a national scale and wanted to understand what the screening patterns are in Canada regarding screening for NAFLD in patients who are obese. So we use this national EMR, which is called as Canadian Primary Care Sentinel Service Surveillance Network, or called as CPCSSN, which is basically a national network which comprises around 11 practice-based research networks that collects a lot of longitudinal data of patients who are coming to primary care facilities across 7 provinces in Canada and have records of over 1.5 million patients. So in this study, we found that over 9,800 patients of children were eligible for screening using ALT because they had a BMI that was over 95th percentile. So concerning, we found that only 23% of these children ever had an ALT testing as suggested by the NASPGHAN guidelines for screening for NAFLD, and only less than 8% had the screening done the past year. So this is quite concerning. Then we did some statistical analysis and we wanted to understand why and who are these patients who were being screened. And we found that if they have had a previous ALT or AST testing, or if they were older, living in urban setting, of female gender, had higher BMI, and were on medications like anti-diabetic medications and anxiolytics, they were getting screened more often than other children. And we also reported the largest published cohort of pediatric NAFLD from Canada, where we have over 1,000 patients who were diagnosed with probable NAFLD, who were obese and had a higher ALT than age and sex related norms. And we found that majority of these children were between the ages of 13 to 18 years, were more males. Around 1/5 of these children also had other comorbid conditions like dyslipidemia, also had diabetes, hypertension, and were also on medications like psychostimulants and antipsychotic medications. These were the trend which have been previously published by others in pediatric NAFLD world, like from US as well. So we just reciprocated the same data here in Canada. So basically, to summarize, that we examined that proportion of obese children who were being screened in pediatric in primary care health facilities in Canada, and we found really low screening rates. And then we also published the largest cohort of pediatric NAFLD from Canada, which is similar to what previous other people have published from across the world. Yeah. So this was really concerning. And we think that there should be a clinical referral pathway for pediatric NAFLD as have been, developed for adult NAFLD. But unfortunately, things like FIB4 and other modalities for non-invasive biomarkers are not very well validated in pediatrics. So we have to work more on these lines so that a care pathway can be made for pediatric patients as well.
Yeah, I mean, it's really scary and fascinating at the same time. I have a few questions for you.
Yeah.
The first one was your feedback on the thought that the guidelines, I think is in the US, just changed very recently, like in the last couple of weeks, where they actually created a chart as a growth chart. And so clearly obesity is a bigger problem than originally anticipated, and there's a lot more children in that high end range.
Yes, for sure, for sure. You know, from if we are with so pediatric NAFLD epidemiological data in Canada is not very much there, but over the past 2 decades or so, we have seen that Canadian children are getting more obese over the past specifically 10 years or so. And because obesity is one of the most common risk factors for pediatric NAFLD, we assume that the trends are reciprocated in the NAFLD world as well. So definitely, and the recent guidelines that were published by American Association of Pediatrics were in line with that, and they did recommended that instead of just talking about counseling for weight reduction, we should now start to think more about in the line of management and treatment options for these
Exactly.
children, like things like semaglutide and other things should be offered
Yeah.
once lifestyle changes fail.
So the watch, wait, and see is not
Is
not
not the best.
recommended practice
Yeah,
anymore.
yeah. So, most of the children will start with lifestyle changes, but if they fail and you're having barriers, then definitely thinking about medications is the way to go.
Okay, well, hopefully some of the awareness about those guidelines will work in Canada as well, and it'll change the practice because I looked at the numbers too from the study. That means there was actually 7,552 children just in the group that you looked at that were never assessed and should have been. If you do the
Yes.
math, I mean, 7,000 kids who were in the high end of the BMI chart who should have been screened, assessed for fatty liver, and were not. And I hope that through awareness like what we're talking about today, parents will be a little bit more diligent with their physicians in their discussions to try to encourage them to get assessed for liver disease as well.
Yes, for sure, for sure. And as you know that NAFLD does not have any peculiar clinical features, right? So the onus comes on the primary care physicians, the pediatrician, and even on the parents to get these kids screened. And
I,
majority of them will not need treatment, right? Just a lifestyle changes and some common things around, what to eat and how much to exercise we'll be able to manage this condition in a much better way.
Okay, I have just a couple minutes left, but I wanted to ask you, in your practice, how many patients, children, do you see with NAFLD and NASH?
Yeah, so since I have started at CHAO, it's been like 2 years. I currently follow over 120 patients
Wow.
with NAFLD. And many of these children, so we do have non-invasive modalities like fibroscan in our clinic,
Right.
and we assess them, serially and longitudinally just to assess their, fibrosis. We also do clinically needed liver biopsy, and I'm really concerned sometime, many of these patients have F3 and F4 fibrosis at the time when they presented to us. So if these patients could have been screened earlier or detected earlier, the lifestyle changes, if done appropriately, they might not be able to progress so rapidly and so advanced in their disease. So that's
Uh,
quite concerning.
Very concerning. The couple things that you said too. I mean, the fact that the liver disease is silent in most cases till it's too late. And the other thing, it's possible, we didn't talk about this, but because of the COVID pandemic, that there has been a lot more children and adults gaining weight, and of course having a lot of the metabolic associated issues with fatty liver disease and NASH, right?
Definitely, definitely. So these are the long-term issues of COVID pandemic, which we will see in the next, I would say 5 to 10 years down the road. And we as a medical community should be ready to have that post-pandemic phase, and we should be ready to manage these patients. In adult world, there was higher risk of alcohol use, higher risk of obesity. This is really concerning for sure.
Okay, just to finish up, what one recommendation would you make to people that are watching this, either physicians or even patients and their families? What would you say?
I would say that pediatric NAFLD is now the most common cause of chronic liver disease, and screening is the key to go because children will now never have any symptoms. So just go and have them assessed by a primary care physicians. And if there is an issue, early referral to a gastroenterologist or hepatologist is the key to go so that they can be appropriately managed and triaged.
Great advice. Thank you as always. We're going to do more of these together, and I really appreciate you taking the time to share your results with all of us.
Thank you, Michael. Thanks for this opportunity. You're doing great work.
Thank you.